in Cameroon. So we managed to talk informally, and we found out, first of all, that the certificate was issued by the wrong minister. So after all this time that we spent, several months, so the certificate was supposed to be issued by the Minister of Environment. So we went back to the poor guy in the lab there and said, look, the certificate was wrong. So we need to go back to the Minister of Environment. And then we wrote as well ourselves letters to the CBD focal point, asking if they could help the researcher, to develop with us an agreement. So we wait for probably 6-8 months. We didn't get any reply from the Minister of Environment, from the CBD focal point, although she said that she was keen to help and to solve this issue, particularly to enable the researcher to start to do some work with us. And finally, after 6-8 months, we got a letter from the researcher who was thanking us because he was really happy that we helped to raise the issue. He said to us that he learned that the Prime Minister's office was considered to establish an interministerial committee, as there were so many ministers involved. And he was hoping to have any result of this discussion soon. So, but we wait still a few more months, and finally, we decide really to close the file because there was no point to keep it open, particularly because it was not for us a major area of research. So the bottom line of this experience that was useful to see the bottleneck at the country level was that you couldn't start any collaboration, and therefore for the Cameroon researcher there was no benefit sharing, and that was a pity, and there was no transfer technology that could be very useful as well at the local level. Of course, ultimately there was no medicine available. So this experience that we just, particularly the last one, showed that from the company point of view, what is very important is to have a contract in place and to have a legal mechanism at the country level that allow and access to the materials, and as well a prior consenting form is provided. So first of all, why the contract was good? And it was good, for example, in the case that I mentioned before for Costa Rica, because it can document the different aspects and steps of the access, so that it stay black and white, and then when there is a dispute or there is a discussion with the government that is supporting the provider, there are clear milestones there. And what is important as well, that establish benefit sharing upfront at the time of access, and not at the end as a discussion now on the disclosure on the patent system. Because a lot of products, as you have seen from the slide before, so they never come up as a medicine or as a register. Or even if they come up commercially, maybe they are never patented. That, for example, is in many of the food supplements. They are coming from natural resources. They've never been asked for a patent. So in principle, there's no benefit sharing unless there is a sound contract in place at the beginning. So one of the other benefits, of course, is the licensing fee that we were giving to them, and the transfer technology that as well, if it's well done in the contract, is a huge benefit for the local researcher and the local institution. And that's not contemplated for sure in the patent disclosure. So based on that example, of course, on what we had, we believe that most of the information that are on the Convention on Biological Diversity, reflect the need for the contract and for the access benefit sharing. And what is very clear as well on the CBD in the articles that you just see on the slides is that most of the agreement has to be done with a kind of mutually agreed terms. That's what is very important. So not only the access that is in Article 15.4, but as well the benefit sharing has to be very clearly mutually agreed from the beginning, and hopefully what is very important, particularly in small country or in country in which the research activity are very modest, that the government is supporting the provider in the drafting of the agreement. And as well, in terms of research, both party has to agree which type of research they want to undertake, and has to be as well agreed together. And finally, as well, is the transfer of technology that has to be agreed as well on that. Now, to implement this provision of the CBD, I mean, we believe as well that there is a lot of information, a good source of knowledge in the guidelines that has been developed in 2002 on the Bonn guidelines that have been adopted by most of the CBD member and parties. As I was referring before with the Cameroon case, so it's important to have a national focal point. A national focal point that can inform the applicant what you need to do in order to have access to the genetic resources, on the procedure to acquiring that, and as well how to start the informed consent, prior informed consent in a mutual agreed term. That was the case for Cameroon, but beside the focal point, there was no national law in place. That's why we need to have a competent national authority. That is key. It is responsible for advising particularly the local researcher that they want to undertake a new way of research, but as well they need to monitor how the access and benefit sharing working, and as well enforce some of the agreement component that has been laid down. In addition, in the Bonn guidelines, as you see, there is a list of basic requirements for mutually agreed term, and usually they give very specific information what you should or you should not include in the agreement. And the Bonn guidelines, it goes so far as well to give very specific suggestion which element you have to put in the agreement for the material transfer. That was as well very important, particularly at the beginning, because otherwise you cannot even start the research process. So we believe that some of these point and provision are well designed and clear, that they should help the national authority to improve a little bit more the current situation. So conclusion, I mean, I presented just these two Lilly example, one in Central America and one in Africa, but there are many more examples from many other companies that have had the same experience, some positive and some less positive. But our experience really showed that if there is not a national policy in place, we cannot really, enter in any agreement. So this is the most important part that we want to emphasize, to have a clear national policy in place, regulation that we can follow together with the researcher at the country level. And often, as I was mentioned before, the national policy and the suggestion on the agreement can provide benefit upfront rather than waiting for the end of the chain where nothing is going to happen and there is not going to be financial incentive for the local researcher. And then, of course, that discussion, I think the next speaker will go much more in the detail. But the point that we believe that the patent system is going to be much more a hurdle for the ABC, because it doesn't bring in place all the compliance that you want to have when you start an agreement, and increase as well the uncertainty, because it moves the border not to the two party and to the government to control, but often to the patent examination office that is not equipped to follow all the different steps that was mentioned in some of the slides before, but as well that I was alluding to when I was referring to the Cameroon case. So with this, I end my presentation. Thank you.
Thank you.